Hi there, it's Dr. Jim. My topic today, sexuality and dementia. Despite the many health-related problems that might interfere with a healthy sex life, the majority of older adults remain engaged in sexual activity, and they view it as an important part of their life. Some individuals may not be completely comfortable talking about this. I understand that. And others will forget about it or ignore it altogether when the older adult is cognitively impaired due to some type of dementia-related illness. In general, older adults who are more physically active also tend to be more sexually active. Sexual activity and intimacy are shown in research to be associated with increased well-being and life satisfaction. Some studies suggest that sex can actually decrease pain, improve cognition, and quality of sleep. Sexual activity also releases brain chemicals that make people feel happy, reduce stress, and they also strengthen the immune system. So there are biological, psychological, neurological benefits of sexual activity in adult life, older adult life. Despite these benefits and many others, sexuality is ignored when caring for older adults many times. Not altogether, but many times. So let's talk about sexuality in skilled nursing centers, long-term care. The topic of sexual activity and expression among older adults and seniors who have some type of dementia and live in a skilled nursing center is difficult for many people to approach. It's kind of a squeamish topic. It makes some healthcare professionals feel uncomfortable. It makes some family members feel concerned or worried. There are those, of course, who do not have any issue whatsoever with sexuality and dementia, and they believe it's a basic right that should be honored in very sensitive and appropriate ways. Person-centered approach to sex and dementia. Interesting. I love spinning stuff. Most senior care communities now indicate that they do believe in and offer person-centered care and person-centered services. If this is true, then there must be permission granted that allows individuals with a dementia-related illness to express his or her sexuality. Safe spaces, as much consent as possible, and developing policies are all important aspects of delivering this level of person-centered treatment. There are some challenges, right? There will always be challenges to allowing sexual activity to occur within skilled nursing facilities or other senior care residences. It's a challenge. The rights, though, of those individuals diagnosed with dementia, as well as seniors who are more cognitively alert, still have to be protected. These are basic human rights, resident rights. Staff can develop the mindset that sexuality occurs across the lifespan. And just because a neurodegenerative disorder is diagnosed doesn't mean the end of a person's sex life. Some staff will not feel comfortable talking about sex with their residents, and they should not be pushed into doing it. I'm not an advocate for that whatsoever. Now, direct care staff, STNAs, nurses, social worker, they might be best suited, prepared, as long as they feel comfortable, to talk about their residents' thoughts and their feelings about sexuality. After all, STNAs, for instance, and in particular, provide 90% of the hands-on care. And a lot of that care is intimate. It's hands-on. So ignoring the senior sexuality is something that we should not be doing because it can have well, first of all, you don't ignore needs, you don't ignore rights. But ignoring those things can have a negative impact on the residents' well-being, self-image, self-esteem, quality of life. So don't they have rights? While most care communities post their resident Bill of Rights in places, public places where everyone can see them, it really does not include the right to sexual expression. I think that has to be updated. Since it doesn't address this important area, each care community can develop their own policies and procedures concerning sexual expression and include cognitive impairment as a part of it. Okay, some rights may include having privacy, having a private space, getting professional counseling on sexuality and aging, the right to engage in consensual sex acts, and to have materials of their choosing. The Hebrew Home in Riverdale, New York, I went to their website, and they do have such a bill of rights for their residents. Actually, it's a policy, I guess. They've created a policy, and they've also reported that it's doing pretty well. It's going well. So here's my takeaway. Everyone's aging. You've aged watching me just now. Sorry, I'm aging too. We're all aging. No matter what happens to us, no one truly knows what types of health or cognitive problems we are going to develop in the future. If sexuality is important to you now, it most likely will be important to you 20, 30 years from now. And if it's not, then it probably won't be either later in your life. Just because a person develops Alzheimer's, Lewy body disease, Parkinson's, or Huntington's, doesn't mean that their sexuality is completely lost for good. Actually, it's quite the opposite. I'm Dr. Jim. That's my take on sexuality and dementia. Please forward this to a friend or a colleague and subscribe to my YouTube channel. I would greatly appreciate it. Take care.